we are talking about colon cancer. It is one of the more common types of cancers, and the numbers are showing increasing cases in younger adults. So here to talk more about that trend and what we can do about it is Dr. James Sahawneh, and thank you so much for stopping by. Sahawneh, yes?
Sahawneh, but it's okay. It's all right.
Okay.
Yeah.
All right. I did that just to make you smile
Very
because you
good.
did say that you were nervous. So now that we got that out of the way, we are talking about a sensitive topic.
Yeah.
You know, most people have heard of colon cancer before, but talk about how common it is now.
So colon cancer it's a cancer that's found in the large intestine. It is in women or men, the third most common diagnosed cancer, usually in the United States. And in terms of mortality, it has the second highest mortality in the United States. Yeah.
And we were talking off camera about the reasoning behind it being more commonly found now in younger Americans. In addition to getting those diagnoses early, what can we do in terms of prevention?
So for prevention, realizing that your risk factors, so if you've had family members with colon cancer, if you have IBDs, things like ulcerative colitis, or Crohn's disease, but in terms of prevention, things like avoiding a sedentary lifestyle, avoiding red meats, avoiding heavy alcohol consumption, and then smoking tobacco.
I always like to talk about the treatments because when people hear the word cancer, it can stop your heart, but the good thing is with all the technology we have, there are treatments available.
Yeah, so typically, it all depends on what your stage is and the biology of the tumor.
Okay.
So if it's an early stage, the survivability of this is pretty high. It's over 90%, and usually will involve surgery if it's colon cancer. If it involves stuff like rectal cancers, will usually involve things like radiation therapy and oncology. But yeah, there are multiple therapies available, and it all depends on what stage you are in biology. And
I'm curious, what happens with colon cancer? What exactly is being done to your body when you've been detected with that?
So it usually develops from something like a polyp, typically. Sometimes it's sporadic, but the polyp will eventually turn over time, over a long period of time, into a cancer. And then once that's diagnosed, usually with colonoscopy, we move on to things like getting scans, CT scans, and looking at the biology and looking with the pathologist, and then, yeah.
Okay, and then you determine a treatment plan and you take it from there.
Yes.
So a lot of honesty is involved. Is there anything else, for people watching right now, they're thinking, I'm not of a certain age, I don't need to go in for that screening. What do you want to say?
So we recommend everyone over 45 get a screening colonoscopy. This is determined for all Americans. So when we make a recommendation like that for everyone to get, realize that it's that prevalent in society, and it is preventable if you can, in most cases, if you can get this caught early.
All right. Well, thank you very much for stopping by. Is there anything else you want to add before we wrap here?
Thanks for having me.